I'm extremely excited to talk to Dr. Anand. Welcome to Tomorrow's World. Tell me first, where do we stand in terms of medical treatment?
In very brief, if I can describe you what is the real status, like if we divide all the categories of human diseases a human may face in entire life, there is 3 categories. First category is when a human gets infection or some disease because of some kind of infection.
Like bacteria or virus.
Bacteria, virus, or maybe microorganism.
Correct.
So at the present time, we have extraordinary antibiotics. 95% time you can kill the bacteria and person is treated. Same in the case of microorganism like malaria or several kind of amoebic problems. We have antimicrobials where you give the patient and the patient is treated. No more microbial problems. Third category is viruses. That is also outside infection. But those infections like Zika, HIV, you name a lot of viruses. We do not have any treatment today for the virus, though it is a foreign infection. So first category, if you take 33%, then remove virus, only 20% diseases we can treat. Second category comes with the trauma. Like we have accident or bone broken or some kind of surgery, where surgery can remove the disease. And today it is wonderful surgery, doctors are good, equipments are extraordinary. Rest 70% diseases happens just no foreign infection, no trauma, just some kind of malfunction of the body. And these diseases comes either degeneration of the organs or over-functional of the organ.
Well, that sounds like an alarming percentage of diseases that has no cure today and no treatment.
No treatment. Huge. So you see, this is all the degeneration of the organs. When we talk about the degeneration of the organs, the only solution may be if we may develop some kind of regenerative medicine, which may regenerate all these organs which are losing function or damaged because of any reason.
Now, give me a little bit history of when did someone start thinking about regeneration?
And this was the question came to my mind also 16 years back. I was also thinking how to really regenerate the organs. So you see the wall lizard, when you cut the tail of a wall lizard, it regenerates automatically. So seeing that, it means there is something in the biological system which regenerates the degenerative organs.
Yeah, obviously, because if I cut myself, the skin joins, so it has regenerated.
Wonderful, wonderful, yeah. Exactly. It means there is some cells, and same as the skin. Okay, but if you cut the bigger portion of the skin or there is a big damage, you have to really manage a lot. Okay, and even if you manage, somehow it will be repaired, but you will see the scar. So it means there in our body also there is something. And that is the master cell of the body which makes whole body, and that is what is the stem cell. But in our body, that when we become adult, that stem cell is not in much number.
Then how do you come to the regeneration of every cell through the stem cell that you're talking about?
We have the master cell which makes each and every single organ of the body. When the organs or any organ damage in our body, that master cell goes and try to repair it. But if the damage is big, that master cell is not big in number. So what we thought that can we take out this master cell in the lab? Can we make billions of these cells in the lab? And what happens if we inject back in the body? Is that going to repair that damage?
So if I understand it correctly, you're taking the stem cell from the body of the person and you're multiplying it outside the body to make it more effective and faster.
Yes.
In regeneration.
Yes.
Because the body is not capable to regenerate it as fast as you could do it in a lab.
Exactly. So what we do, we take out those master cells and I develop the technique. So I can clone these master cells, or I can proliferate, make similar kind of cells in the lab, and then I can inject in the body So suppose liver is damaged, or heart is damaged, brain is damaged, kidney is damaged, or any organ is going under degeneration, or lung is having some problem. So we inject that master cells goes there and tries to repair it. So that is what the real answer of these kind of malfunction. Even now we are under the process to in fact make the organs outside in the lab, in the laboratory condition. Suppose somebody's ear is gone, we can develop whole ear in the lab. Suppose nose, we can develop all nose. Even the liver cells, okay, we can regenerate all the liver cells outside of the body and transplant those liver cells to repair a damaged liver. Because today, if the liver is damaged, only one option is the liver transplant, and that's very complex option.
So, cosmetic, non-cosmetic, organs of the body, any part of the body can be regenerated. That's the interesting part.
I am trying, and
I mean, there's so much hope to having diseases that we thought were not curable, to find a cure or even have a hope towards that. That's incredible.
So a lot of scientists, including me, are working very hard to develop the cure of these kind of diseases also. At this time point, we can manage using the stem cell, but we really want to cure it.
So absolutely, if I can add a drop to this whole thing, I'd love to do it and inspire the world to actually look at this and find solutions to people's happiness and life, that they don't have to really die at an early age or create so much trauma, stress to the family. I mean, that would be fabulous to achieve, and I'm sure we are all on the right path. And we thank you for contributing your big portion to it.